Good morning. It's good morning. Good morning, Diane.
Good morning.
It's great to see you. Now tell me about your background. Do you have, is that a Zoom background?
My childcare wear background.
Yes, it looks like
Yes,
a portrait.
it is. It is. We've had these for 5 years now, which is kind of crazy to think about. I've had the same background.
We've been doing a lot of thinking back to 5 years ago. We had our 5 year anniversary of the 9:30 call, but also the context that we're living in is feeling very COVID-y about getting accurate information. And just continuing to be a community for each other and for support. So it's great to have. Have you been to the 9:30 call? Yeah.
Yeah, I've been on before.
Yeah. All right, good. Um, we'll give folks a minute. We usually start at 9:33. And for folks tomorrow, we have the sharing the mic. And we often get emails about like, can you let your people know about this? Tomorrow is the time to do it. So even if you can only come for a bit, we will have time for announcements. You can put things in chat. We've still continued to have great attendance coming to sharing the mic. And then, last week we talked about children getting doctor's notes to come back to programs, even though they don't have a fever, they're still lethargic and kind of need to lay down. And so kind of hearing that feedback this morning, I was on a call, the Child and Adolescent Health Initiative. Um, and I mentioned it to the head of the American Academy of Pediatrics, Massachusetts, about the doctor's note. And so she said, yes, this has always been a thing, but sounds like we need to kind of revisit it. So I invited her to the 9:30 call. And the other thing is Donna Condon did share her health policy. So I'm going to put that in the 9:30 call follow-up. But that's just one example of kind of like what happens at sharing the mic. We kind of do all the research we can to get more information, and hopefully we can have a follow-up on that. Well, Diane, we're so excited to have with you and to hear more about the work that you just released. But as you know, our first question for all 9:30 callers is for you to tell us a little bit about you and how you came to be in your current role.
Awesome. Thank you for having me on here to share about this new resource. Hi, everyone. My name is Diane Girouard. I'm a senior state policy analyst at Childcare Care of America. Child Care of America, you haven't heard of us. We're a national organization that supports every part of the child care system. We represent child care resource and referral agencies across the country, and together with on that ground network of CCRNRs working in every single state and communities, we drive research and effective policy and practice, help families finding and affording quality childcare, and really building up those strong childcare programs and professionals nationwide. So I have been with Childcare of America for 5 years. I've always worked in the education space. I started literally 5 years ago to the day. So when things were all kind of absolutely
Right.
on, yeah, just crazy. Um, so I've always, but before this, I worked on improving school meals access, including enacting universal school meals policies, the Food Research and Action Center. Spent quite some time working in the New York State Legislature and the education committees before that. But I think most importantly, after college, I grew up in Massachusetts and I moved back home. My parents still live in Wrentham. And as I was figuring things out, was interning part-time with the Massachusetts Democratic Party, but I also worked part-time as a teacher's assistant at the Children's Place, which was a child care program in Wrentham. Worked there for a few months and it was incredibly rewarding, but also probably the most challenging job that I've ever had in my life. And really happy I get to bring those few months of experience kind of full circle. And now I'm in the EC policy space and have been for 5 years. So full circle moment, but our educators are doing, yes, love the Massachusetts connection, but yeah, are just doing the work and it is so hard.
And I see Kim Dion is here from our R&R system. And so Kim has been doing an incredible job. And I'm sure there are other R&Rs on today. So thank you for that, Diane. And if you need to share your screen, you should be able to do that. We look forward to your update.
Awesome. Give me 2 seconds to figure out how
Yes,
to share that. I'm in the
as we
office and
say.
I'm on one just my laptop because I can't connect the monitors. So one
Oh, well,
second.
we always say this is the hardest part of the 9:30 call. And recently at our live broadcast of the 9:30 call in Worcester, I had to bring up the slides and was panicking because it wasn't working. And someone in our live audience said it's always the hardest part of the 9:30 call, which is
It
true.
really is.
It
All
is.
right, I've clicked. Let's see, get out of this. See if this will work. Okay, I think I just have to go into presentation mode here, which I don't know if I can do.
Yeah, so if you just go, I think if you go to slideshow, we can see it's up.
It might be small. I'm so sorry. I'm trying to move.
So what we can see is the slideshow and then like so it's like in normal view. So if you that there you go.
Yay, awesome. All right,
Well done.
thanks. Technological difficulties. Oh, I'll start with just kind of going over this resource, and you can drop the link in the chat after this too. But I'm sharing a new resource that we've created based on conversations we've had this fall with some state partners, childcare resource and referral agencies about public-private partnership models in states. Especially going to dig into one today called TriShare because it is very trendy and we keep hearing it. It's popping up in states, may have popped up in Massachusetts even. Um, but first, just to kind of level set, we talk about public-private partnerships. We're talking about is leveraging support from both the public and private sectors to attain a shared goal. So this can be a really effective strategy for bringing together and maximizing diverse resources, perspectives, and expertise. There are a couple of different models for public-private partnerships in childcare and early learning that we've seen examples of in states. And while they're all very different, they're very unique in structure. They all have these same general characteristics, which are they bring together the public sector, right? So that's the federal, the state, the local governments, and representatives from private sectors. That's employers, philanthropic foundations, chambers of commerce, community organizations around some shared goals. And sometimes these models occur in conjunction with other stakeholders, such as parents or nonprofits. And generally, each partner is contributing some time, some money, and some expertise or other resources to the partnership. And then decision making and management responsibilities can be shared among the partners. So I'm not going to get like too, again, I'm going to dig mostly into TriShare for this. This resource does share a couple of other types of partnerships as well. One being setting incentives or requirements for employers to invest in childcare to support their employees. And in the resource, we dig into the Federal CHIPS Act because it requires semiconductor manufacturers that apply for more than 150 million of the CHIPS direct funding to develop a childcare plan for workers through or on near-site childcare. These could be prearranged agreements with existing childcare providers. In some places, we're seeing the buildup of new programs on campuses for these semiconductor manufacturers. So we have two examples in the resource there about Intel and Global Foundries in New York and what they are doing to build up childcare capacity in those communities where they are now have these semiconductor manufacturing companies. And then the resource also explores pooled funding from public and private stakeholders that's distributed to programs to support it could be provider compensation, construction or major renovation of a program, supply building generally, or even some short-term operating expenses. So there's some cool examples of this happening right now in Kansas and Iowa. Kansas's a children's cabinet launched this childcare capacity accelerator grant, and it supports new construction, renovations, operational costs to increase the goal is to increase the number of licensed childcare slots statewide. So here they're braiding together state and federal funding along with philanthropic funding. And they're having communities match this funding at the local level too. And I think they saw in 2023 that there are 53 grantees secured over 31 million in matching funding from private sources. So really like just trying to think of these unique solutions or creative solutions to build up more funding in communities. Iowa has the Solutions Fund that they started at a pilot level. They're building up to be a statewide model. And again, it's blending together the state and federal funds along with private funding. And they've seen some success in being able to use that towards like childcare compensation too, which has been really neat. And then the final one, which we'll get into the slides here, is sharing childcare costs between employers, employees, and the state and local entities, commonly called tri-share. It's not called tri-share in every single state. And again, sharing about this just because it is like a really trendy topic right now in
Yeah.
childcare, early learning, and there are pros and cons, and I think it's really important to think about both, especially if you're in conversations with policymakers and they bring this up. It's a really big buzzword. So.
And Diane, I'll just share. So last Monday, JD Chesloff was on the 9:30 call from the Mass Business Roundtable. And as you said, there was language in our budget for 2.5 million to kind of create a program around employer sponsored. So we have that happening right now, in Massachusetts. It was in the budget last year. So thank you for acknowledging that.
Interesting. I was like, I thought I saw it in Massachusetts.
Yeah,
But I do have it. Actually, I do have it. You guys on
you
the
do
slide
have
from
it.
last year.
Yes.
Yeah, perfect. Great. Um, so yeah, okay, then let's dig into it because it is it's just an interesting concept. And we're learning more and more as time goes on from the states that have implemented this. So, TriShare, what the heck is it? It's a specific type of pooled funding. It's again that private-public cost-sharing approach that splits the cost of childcare tuition three ways. That's among an employer, among the employee, and then the state. Michigan is often highlighted as the first state to secure state funding for this TRISHARE program way back in 2021. And since then, it's gained popularity across states like New York, put funding in the budget last year for it. Connecticut is about to have a program launch with one of their big employers in New London and County. Kentucky is doing the statewide. North Carolina has a pilot program. North Dakota has a pilot program. And Ohio is exploring a pilot program. So this is happening in a bunch of states. And we saw a bunch of states introduce it last year. We've seen a bunch of states introduce it again this year, especially in governor's proposals. We've also seen that this model can also happen at the local level. And let me know if my sound goes out. I keep getting a uh, little icon on my computer. I'm not sure what that means, but
We can still
we've
hear
seen.
you.
Okay, great. Thank you. This can, again, happen at the local level. Rapid City in South Dakota is using philanthropic funds from a private foundation instead of state funding to operate a tri-share program locally. So it doesn't just have to happen at the state level. So again, each state's program is modeled a little bit differently in how it's coordinated, where it's available, how much state funding is provided to administer the program, and who is eligible to participate. And we'll get into that in just a second. But overall, benefits, right? There are good things about this program. It's going to reduce out-of-pocket costs for families who don't typically qualify for subsidy. It provides reliable payments to participating providers and can help them market their program that they're participating in this. Maybe attract some new business or new families into their program and helps employers attract and recruit and possibly down the road retain employees. This is still pretty new, so we're not really seeing that yet, but there absolutely is a potential for that. And it has the potential, of course, to help support economic development locally and statewide. So far, no two states have had the same exact program. Again, there's a lot of similarities in how they're structured. So we have this chart. This chart's also in that resource that we just put out. But this talk looks at coordination, participation of eligibility, and funding sources in four models: Kentucky, Michigan, North Carolina, and North Dakota. So Michigan and Kentucky have statewide programs. North Carolina and North Dakota have pilot programs. They're all splitting their costs among families, employers in the state. They're not all called tri-share, but that's the term I'll use just because it's the one that most people share and use. But a quick overview in Kentucky, the cost of childcare is shared by families, employers in the state, but the amount contributed by the state changes based upon the family size and income level. So that program is really different than how the other ones are structured. In Michigan and North Carolina, the cost of childcare is split equally, so three ways between the employer, employee, and the state. In North Carolina, there's a 9% administrative fee that's also collected from both the employee and the employer on top of the split cost. In North Dakota, the program is again it's split three ways, but the employer provides a monthly child care benefit and opts in to the program at that state match at either $150 or $300 level. So all of these are very different. Kentucky and North Dakota both coordinate and administer the program at the state agency level, whereas Michigan, the program was initially set up where it was coordinated regionally by a facilitator hub, which includes organizations like the CCR&Rs and other community nonprofits, United Ways, who are running these programs. The facilitator hub in Michigan served as this entity that was determining eligibility, recruiting employers to participate, connects employees with childcare providers, and collects payments from employees in the state. So again, Kentucky and North Dakota, they're doing this all at the state agency level. In North Carolina, the program is also coordinated regionally by the Smart Start Network regional hubs, which provide administrative support of the program at the local level and work to recruit businesses and childcare programs to participate. North Carolina also created this, it's really interesting, a new childcare business liaison position at its Department of Commerce, which has helped with program design and really connect with the businesses too. They were learning from what happened in Michigan to make their program a little bit, really just lessons learned, best practices to incorporate to make it run a little bit more smoothly. Eligibility, it's so interesting. So in Kentucky, North Carolina, Michigan, families cannot qualify for subsidy to participate. So this is for families who are above the subsidy eligibility levels. And again, in Kentucky, any family who doesn't qualify for subsidy can participate, but the percentage of the state match decreases as the family income rises. In Michigan, North Carolina, Michigan 200 to 325% of the federal poverty level to qualify. North Carolina, it's between 185 and 300% of the federal poverty level. North Dakota, the program is only available to families with young children, so from birth to 5 years, so much more limited in who can participate. And in North Dakota, families can participate if they qualify for subsidy. However, they can only participate in this program or they can participate in the subsidy program. They can't participate in both. So that one is a little bit weird. And then funding has been so wildly different across the state. Kentucky was initially seeded with $15 million. They've made the program permanent, but they've added a little bit more and more each year. Legislation in Kentucky requires that 25% of the funding be set aside for small businesses with under 50 employees. I thought that was really interesting. Michigan started the program with $1 million. They're at 3.4 million now, so way different than 15 million. North Carolina started their program with 900,000. In North Dakota, the program initially received 5 million and then an additional 9.6 million. So again, very different funding amounts across all. And I want to bring up really quickly participation, because again, like we're seeing these, it's a buzzword, it's trending. Updated participation number is not available for all programs, but to give you an idea of the size of these programs, as of January 2024, so now over a year old data, only 35 employers in Kentucky had signed on and were contributing to the childcare costs of 133 children. So you have over $15
Wow.
million put into this program, and you had 133 children. There was a recent article sharing that Michigan's program, which was established in 2021 and has gotten funding year after year, was now serving 900 children. So it had a really slow start, but it has grown. They are hoping to serve 7,500 kids in the next couple of years, but they're only at 900 right now. North Carolina, which was launched this past summer, had, as of February of this year, had 9 children participating. So $900,000 allocated to this. I know they're doing some heavy marketing down there to bring up the program participation. So just a really slow rollout. So I want to talk a little bit about just quickly challenges kind of lessons learned, what we're hearing from states as we're talking about this with them to find out, how is this program working? There are definitely some common challenges to implementing these blended financing strategies around the tri-share model. So think about as your state is maybe considering language around this. On the administrative side, like the system side, while they can absolutely these programs be leveraged to create more robust financing for childcare, these are not going to address longstanding issues around access, affordability, and low provider compensation the childcare systems typically face on a broader scale. Second, we heard this from our Michigan CCRNR a bunch. There are so many administrative costs to staff and run the program. This includes coordinating the funding, determining additional eligibility requirements, promoting the program, marketing this program is a huge part of the work that needs to be done here. And in instances where a community partner has been selected to administer the program, staff are needed to act as a liaison between employers, employees, and childcare programs and the state. And this can be really costly for a community partner who might need to hire an additional person or reallocate existing staff to be the point person for tri-share models. We've also heard again from states that you really need heavy marketing to build awareness among providers, families, and employers. That takes a lot of time and resources. Another concern that we heard is that reimbursement process and cash flow challenges can exist. If there's varying billing cycles, or employees are exiting and entering the programs at different times. There's also an administrative burden for providers too, to complete individual invoices for children of families participating in the program. This can result in needing some help from a facilitator or regional hub providers prepare these invoices. Also, some challenges for employers who need, for employers too, they need to gauge the interest, employee interest. They need to plan around their company budget cycles. They need to update their HR policies. And if the program is in a pilot phase, they might be really nervous to participate if this isn't long term. And then they have to pick up the bill in a couple of years. Also, this could be one governor's prioritization, and it might not be the next governor's prioritization. So this might end. And then businesses with smaller budgets may find that while they're interested in offering this benefit to their employees, they also have limited financial resources. Then they might not be able to commit, or they can only offer to a percentage of employees or limit it to one child per family, which is what we saw happen in Michigan. And on the employee side, um, it may help retain workers, but might not align with family decisions to move, or if they want to leave an employer, they might feel like they have to stay in this job to receive this benefit. Additionally, these programs are limited to availability within a community. So if there's a lack of supply, a family still won't be able to tap into this because they still can't find a program. And then again, in most programs, this is only available to families who don't qualify for subsidy. So it's not maybe helping the lowest income of families. Um, so we went through that really quick and just a couple of lessons learned. Legislation must include sufficient funding for administrative costs. We hear this again and again from states. That North Carolina and Michigan are both charging administrative fees on top of the costs that are split a third, and a third. They're charging employees and employers because there wasn't enough administrative funding to make the program work in the way that they want it to. Setting aside a portion of funds for small businesses like Kentucky is doing can help make sure that smaller employers can participate too. Making sure all programs have uniform contracts and paperwork and eligibility requirements to minimize confusion and increase efficiency. North Carolina is leveraging an established third party to help streamline efficiency and has a dedicated person now within a state agency to help work with this. And you really need a strong marketing team. So that might include your state and local chambers of commerce, child care advocates, state partners, state agency staff to get the word out. And last but not certainly least, when sharing about the program, its potential for lowering costs for some families, policymakers need to ensure these conversations are happening at the same time as talking about additional, robust, significant long-term funding to address affordability and accessibility in the childcare system. So these conversations cannot be happening by themselves. They're a piece of the puzzle. The puzzle's really big. It's really complicated. This is just one small sliver of it. That is my giant rambling on these programs.
Well, the chat has responded as always. Plus, just a note, it's great to see that there were 90 plus people on the call this morning. So one of the things, Diane, I wrote so I put your description for today, including the link to the report, and then you're the resource, and then would love to know if you have contacts in the other states so that we could invite the other states to come, because a lot of these questions I think are very specific to the states. So what are some key lessons from Michigan and other early adopters, and what is the ratio of the shares? Is this similar to town grants funds for childcare for residents? And then I'll just do three at a time. What are the states who are doing this basing their costs on? Are they actual costs of care or with market-based that doesn't necessarily support a well-trained and supported workforce?
Yeah, we can absolutely. We have a really great CCRNR partner in Michigan who has been able to come on and share with a couple of other groups about because she is one of the facilitator hubs that is running the program, so can absolutely talk more about the complications behind it. We've learned so much from her that right, it is a lot of administrative staff time and resources.
Right.
And it's very costly to run the program, and you're just doing so much marketing work kind of behind the scenes to get the word out there. And then not every facilitator hub in Michigan did charge that extra 8% administer or 9% administrative fee. In North Carolina, the three regional pilot programs are charging that on top of, right, the third, a third, a third. So it's like not truly a third,
Right.
which is just something to think about. But again, just going back to there just hasn't been enough funding at the state level provided to the regional hubs to administer the program.
Um, there's a lot of appreciation for you sharing all that in 28 minutes. Lucas also shares it would be interesting to see an additional column about the average cost of care in each of these states because we know the cost is so high in Massachusetts.
Yeah, okay, that is really interesting to think about. And yeah, these programs, right? It's just this is like again, it's not for families qualifying for subsidy in any of these states. So I don't
Right.
think any of like that funding it like I know in North Carolina the 900,000 was split exactly three ways among the three pilot
Yep.
regions. So I don't think they're building in that to like reimbursement rates or anything.
Does the seed funding in these models sit in a static account or is invested in some way to grow the asset base?
Oh, that's really interesting. I don't know the answer to that. My guess is it's static. But yeah, I don't because you're getting reimbursed from the state. So you're doing all these billing of the invoices, and then the state is reimbursing you.
Um, Let me see. I also added in March 2025, there was a presentation at the EEC Workforce Council. So Gabby Goldstein, who was working at Labor and Workforce, came over to EEC and is helping, with the implementation of this. Given these are demand side initiatives, Diane, are you seeing the states you talked about pair these with supply side initiatives to tackle workforce issues?
Some cases, North Carolina, no. Michigan, I think, is putting more money. The governor put more money into her budget proposal this year. Kentucky, we've seen Kentucky be one of
Yeah,
the leaders in making providers eligible
yeah.
for
They're
subsidy.
on. Yep,
And that really grows. So like yes and no, but a lot of these bills themselves are not traveling with like, okay,
exactly.
what are the other supply building? How are we,
Right.
driving up reimbursement rates? Like they're kind of happening in these siloed conversations, especially in a lot of other states.
And then if helps with tuitions costs, why doesn't it affect access for those with incomes above subsidy eligibility levels?
Sorry, the question is why doesn't it impact access?
Yes. Yes. If it helps with tuition costs, why doesn't it affect those with incomes above subsidy eligibility? I don't know if Mary Kay, if you're still on.
Yeah, I'm still here. I mean, basically, you said this didn't, one of the challenges was it didn't affect access. And it seems to me it would affect access for people who aren't
I see.
eligible for subsidy, correct?
Yes. Yeah, I mean,
Okay.
it absolutely, like again, right, one of the benefits is you're bringing down costs for families,
Yeah.
which is a really great benefit. However, when you look at it and you're like, North Carolina has 9 kids participating in this program.
Right. I mean, that was I'm going to read Leanne's question, but we don't have time to get to it. Do you have examples of states or projects using ROI tools to demonstrate employers, business, community, the value of the bottom line of investing in employer-supported childcare? I suspect folks on this call understand the value, but I'm curious to see how this is being marketed to employers across the country as a business positive investment.
Yeah, and it's really interesting. In a lot of places, this has been driven by legislators who are curious to know,
Right,
like, they're like, oh, I heard this was happening in another state. Like, this is not as much it's not like there's a for-profit entity that out there that's super, pushing this or anything, which,
right.
some other things has been the case. Um, but yeah, and I haven't seen like, local chambers of commerce like really pushing this or, state chambers or anything like that.
Well, we did have a Boston Globe reporter go to Iowa because they kept hearing about the Iowa
Oh, the
model
Solutions Fund?
and they went to Iowa to check it out. Yes. So,
That one's a good
Diane, this is
model.
your report is doing exactly what it should do. It's sparking question, giving a bit of a detail. But if you could connect me with other states who are doing this, we can invite them and send me the slides because it was incredible to see all that information. And then I will send you the chat so you will have all the questions. And then if you have any other information that you can share with me, I will share it back with the 930 callers.
Awesome. Thank you.
All right. Thank you so much for joining us today and to all the 930 callers for your incredible questions and perspectives. And we will see everyone tomorrow on the 930 call. Have a good day. I'm having deja vu. That's weird. I guess Groundhog Day more.
Thank you.
Bye.